Hello, everyone, and welcome to the second webinar of the 17th Social Entrepreneurship for Innovation in Health course. We will just pause for a minute so that your co-learners and course participants can get into the session. And if you are able to view us properly, I request you to drop a comment in the discussion forum, requesting others who are not able to still see us to refresh their browsers. And also, if you're able to watch us, please find a survey just below the active screen, and you'll be able to see there's a question that asks you, are you watching live? Please click yes to get your extra credit points. I know by now you should be knowing that you get extra credit points to watch live webinars. Okay, let's get started. Hello, everyone, once again, and welcome to the 17th Social Entrepreneurship for Innovation in Health course. As you're aware, the course is part of Global Making More Health initiative. The initiative explores innovative ways to improve access to healthcare for people, animal, and communities around the world. Through the course, participants actually connect with a global cohort of health professionals from across private, public, and nonprofit sector. They all convene to learn the entrepreneurial strategies to create the best social and business impact with their work in the health and wellness space. Before we jump into the session, a reminder once again, please look for the survey and claim your extra points by answering to the question. And remember that you earn extra credit points to watch all the videos on the course platform. And you get extra credit points to watch live webinars. So don't miss this opportunity. Also, drop your question for our guest expert in the discussion forum, and we'll have them addressed during the span of the session. Today's session is aligned with the theme of this week's module, that is entrepreneurial challenges and opportunities. So feel free to ask your question in sync with the theme of this module or otherwise. And now, a big welcome to Dr. Sara Saeed Khurram, who is our guest expert for the session, and she is going to share with us her secret recipe of dealing with challenges and techniques to tap opportunities. Dr. Sara is the founder of Sehat Kahani, a telehealth platform that aims to democratize quality healthcare access by connecting at home, out of work, female doctors to underserved patients in Pakistan. Thank you, Dr. Sara, for joining us today. And we are so excited to hear from you, your experiences and advice with real life examples from your journey. So welcome to the session.
Thank you, Indrani, and hello to everyone who joined the session. It's an absolute pleasure to be here, and I'm looking forward to all the questions. So please, in the session, if you feel that there's any question you want to ask, please do post in the forum so that we can answer as many questions as we can.
Great. Dr. Sara, you have a rich background as a doctor and a social entrepreneur. Could you please share with us your journey of transition from being a medical professional to a social entrepreneur? How do you balance the two hats that you wear?
So Indrani, for that, I'll have to take you to my childhood. I come from Pakistan, and I was born and bred in a middle-class family. And I think my parents, because they came from a background where they weren't very educated, they wanted me and my siblings to get a very good education. And in Pakistan, the preferred mode of education for a woman, if you have money to educate your daughter, is always, or not always, but 80 to 90% of the time, parents want their daughters to become doctors or teachers. And now it's changing, but till my generation, it was pretty much these two professions. Culturally, they're acceptable, religiously, they're acceptable, socially, they're acceptable. And out of the two professions, obviously being a doctor takes the higher lead. There's another attachment to it that if you're a doctor and if you're a woman, and if you're good looking, you get the better hand in marriage. So everyone wants to marry a female doctor in Pakistan. And it's so common in our country that it's called the doctor bride phenomenon. We have so many doctor brides. So when I was growing up, I think from the age 5, my parents told me that I had to become a doctor. I was never given another choice. So I went into medical college. And when I entered into medical college, I saw that 90% of my class was made up of women. And that was very shocking to me. That in a university where you don't find a lot of women, you find overwhelming majority of women. And I realized that, the story that my parents fed me, a lot of parents had fed their daughters the same story. And I was actually happy that, there's a majority of women in some university in the country. But as we started transitioning through the medical years, I saw that a lot of my peers and seniors started getting married and having children. And that's when I realized how the doctor bride phenomena works, is that everyone wants their daughters to become doctors, to get that degree. But then because of the cultural conservativeness that Pakistan has, in which a woman working is considered taboo, as she's neglecting her home or her children, a lot of female doctors never end up working. So they become a doctor, they get that degree, but they don't actually practice. And the repercussion of that became evident to me when I went into my final year of medical college, which is the year when you do internship in a hospital. And I was doing my internship in the biggest tertiary care hospital in Karachi, which is the biggest city of Pakistan. And I remember I was in the medical ward, and there was this thing that I noticed, that a lot of patients came into the medical ward to die comfortably because they were in situations, they came off from far off cities, and they were only brought in when the issues were so significant that they could not be handled at home or through local doctors. So they came to the city in hope that their patient would get treated, but by that time it was too late for the patient to get cured. So it was just, the patient was just managed, and most of the time it was palliative care. So I realized that, there's a huge disconnect, that we're creating so many doctors, but so many doctors are opting out of working because they're women. And then we have these patients in low-income areas of Pakistan who are not getting doctors they deserve, and they end up dying a death which could have been prevented. So this discord was in my mind as well. But as fate happened, I got out of medical college. I was no different. My parents got me married off in 3 months, and I became a doctor bride. The only difference in my story was initially that I started to do my residency. I started my residency in radiology, but I got pregnant in my 10th month, and it was a 2-year program. And the place where I was doing my residency, they didn't have a policy for a pregnant woman to continue in radiology because you needed a 2-year break, and it was a 2-year program. So they asked me to, they let me go, and they asked me to quit. So I quit my residency, and I was sitting at home. And I got very depressed because I thought, my life is finished now. I've become that doctor bride who will have a child and sit at home. So one of my friends, she offered me a job in an NGO, and that NGO had a clinic in a slum in Karachi. And this is a community which has 30,000 people, all living in extremely low income areas, no medical facility there. It's a slum like you have slums in India and other third world countries. And I remember going there, and when I started sitting there and seeing patients, I realized what a difference a doctor being in a community can make, because I could diagnose patients earlier, I could treat them earlier, I could send them to the hospital at the right time. So I really thought I was adding a lot of value in that community's life. When I had my daughter, my first daughter, I had to move to another city. So I had to leave that clinic also. And when I shifted to a new city, I had a 1-month-old daughter, and my husband was working full time. And that is when I finally realized that now I've become the ultimate doctor bride with no chance to escape. I was dodging it up till now, but this time I thought I had no chance, because I couldn't leave my child on anyone. I was expected to play the role of a full-time mother and a full-time housewife and make food and take care of the house. But the doctor inside me was very sad. So I went into severe postpartum depression, and I just wanted an out. So 6 months living in Lahore, which is another city, I got a call from my nurse who was working with me in the clinic, the slum clinic. And she said that, you've left. And because this is such a low income community, a lot of female doctors are not coming to work here. So there's no female doctor now in the community. And the patients come in and they ask me, where is that doctor? How do we reach out to her? So what should I say to them? And I was really bored at home, and I was in depression, and I just wanted to do something. So I said, okay, whenever a patient comes to you, you take me on call, and I'll see the patient on call. And we started doing this, and it started working partially. But then she called me one day and she said, see, whenever I put the speakerphone on, they think this is some drama. This is not a real person, because they can't see you. They can't communicate with you. It's not working out. They still are dependent on me. So we need to do something. So what we figured out was, she had a laptop, and this is not like the laptops we have, the high-tech laptop with the camera in. She had no camera in her laptop. But she stuck a webcam with tape on the laptop. And we started doing video calls. And this is in 2014-15, when Skype was the only mode of communication. So it wasn't there. WhatsApp had come in very, very initially in Pakistan. And I know just doing this in a couple of days, I realized that, I'm sitting in Lahore, the patient is in Karachi, there's a 2,000-mile distance. I'm not physically present, but I'm still able to treat the patient at some level. Why can't we just create this community of doctors, particularly of those who leave their work due to social pressures in Pakistan, the female doctor brides, and connect them to patients across Pakistan using telemedicine? And, it was like a light bulb that went into my heart and my mind. And that was just for me. So everyone else that I discussed it with, they said I was gone completely manic after having depression. But I don't know, from the day one, I had a huge belief that it would work. Probably because I did it myself and I saw the effects. Um, I was never an entrepreneur. I was never taught business. If you know anything about medicine, it is anti-business. You're not taught to deal with a lot of patients, a lot of people at the same time. It's a one-on-one communication. Um, but I started writing a business plan. I submitted it in a startup competition. I had no money. I won that money through a prize in Nepal. I got initial funding for the idea. And that's where the journey started. And I came back to Karachi, my home city, so that my mother and my mother-in-law can help me raise my daughter so that I can work. And I think with that leap of faith and a little amount of money in hand and an idea, I started. Not knowing where it would take me, but I think I just had a very blind belief that it would work, and I still have that belief today.
Wow, what a story that is. I think this Dr. Bride or Dr. Bride had mind and had a sleeping social entrepreneur who suddenly got awakened. So thanks to the depression, postpartum depression, I should say. so, so can you tell us the story of how did you find Sehat Kahani? How did the idea, I mean, we know the idea came, you tested things, but how did that come? And like, how did you establish an organization? And then it just keeps growing. That's why I follow your work. So I see that it's just growing. And I know you have a presentation, so please feel free to take us through the presentation. Screen is all yours.
Sure. I'll try to keep a flow from the conversation. So I won't do all the slides, but I'll try to explain the business as best as I can, because it started off with a solution for low-income areas, but it has become a solution for everyone in Pakistan. And I think that is something that I'm uber proud of. So I just want to share how that happened and what we do now. So I think there are a lot of people who would not understand what Sehat Kahani means. So Sehat means health in Urdu and Kahani means story. And the vision of the company is to democratize healthcare access for all. In English, it means a health story that I want to rewrite more positively. And Sehat Kahani has been created by not only me, but my co-founder as well. So we're actually a female duo who's created Sehat Kahani. And in terms of my experience, I didn't start off as an entrepreneur, but I got the opportunity to represent my work and obviously my country on a lot of international platforms. So some of those accolades are, I became an Acumen Fellow, I'm a Mulago Fellow. I was the first Pakistani woman to win the Rolex Award for Enterprise. I'm a Cartier Fellow. I recently became a Young Global Leader by the World Economic Forum. And I think those accolades, and me and Ifat were named the Heroines of Healthcare by the Women in Global Health Forum in 2022. And I think now both me and Ifat have a 14 years plus experience in digital health, in public health, in community medicine, in corporate pharmaceutical sector. So we really worked hard to build our profile to suit our business and the work that we do. And I've already talked about the problem or the scenario in which I started, but just contemplating it with some numbers. So Pakistan has around 245,000 doctors, and we have a population for 220 million people. We are the 5th largest population in the world. So that means we have one doctor for 1,000 patients. 80% of our total medical workforce is women. So Out of the 80%, due to the doctor bride phenomena, only 40% practice. So we lose a huge number of female doctors to the doctor bride phenomena. And additionally, there's a lot of medical doctor brain drain in the country as well. So 15% of doctors leave every year for better work opportunities. So it leaves us with half a doctor of 1,000 patients, which is way below the minimum WHO standard. And it's very disproportionate. So majority of the doctors work in urban area, very little doctors go in the rural area. And how it impacts a country like Pakistan with 220 million people is that 50% of our population does not see a doctor in their lifetime. So they never end up going to a doctor, which of course becomes a very negative scenario in terms of healthcare. But in the middle of the crisis that I've just mentioned, the window of opportunity that I used was, and that came to my benefit, was that Pakistan is also a population where there's rapid internet penetration because we're a very young population. Over 60% of our population is under 30, so there's a lot of mobile phone usage, a lot of smartphone usage. So we actually, half of our country has access to a smartphone now, and 85% of the country has access to a mobile phone, which of course gives us hope that technology can be a huge bridge between a lot of problems that exist. And also, I think because we're a large population, there's also a market to serve. So I didn't just start this because this was a noble idea. I actually calculated the market for it, and it came out to be 51 billion USD because Pakistan has a huge disease load in terms of chronic diseases, mental health care, maternal and child health care, and patients spend a lot of money for getting treated. And if you calculate all of that, it comes to a 51 billion USD spent in the Pakistani market on just 8 diseases. And I believe, and you know, there are a lot of research papers that also corroborate this, that telemedicine or digital healthcare can take at least 45% of that market and can be handled through digital healthcare initiatives. There's also a corporate market in Pakistan that accesses health insurance. And we believe that a good 72 million people can also access good quality healthcare in the corporate market through telemedicine. So we did a whole calculation of what population we can serve in terms of a review of sustainability. So that's what Sehat Kahani is. We connect a large network of online doctors, and particularly women doctors, to patients who need healthcare using a chat, audio, and video-enabled platform that allows doctor consultations, diagnostics booking, and pharmacy delivery. So really closing the loop for primary healthcare. And this is my team. So you can see all very young people. Almost all of them are younger than me, other than my co-founder. So I've really found strength in the youth of the country building this with me. So I'm very lucky to have found a very, very special team. So over the years, when the story that I shared about the beginning, Sehat Kahani started as a solution in the low-income areas, which is very different as compared to other entrepreneurial stories that you will hear. So we started serving the low-income areas where we used to make clinics, telemedicine clinics. It's a physical space that we revamped. There was a nurse sitting that we taught a software. And when a patient came in, the nurse connected the patient to an online doctor. And we started making these clinics in low-income areas where doctors are not available, just like the pilot that I did. But we realized around an year that we were into the business that only creating clinics in low-income areas will not give us sustainability because the margins were thin, the revenue margins. So we had to add a mass market product and a more upmarket product as well. And we've seen in the clinics that, a lot of people were having access to smartphones as well, and it was rapidly penetrating in the urban market. So we also ended up making an app which allowed any patient to connect to a doctor directly as well. And one of the most interesting features that we kept in our app is that you can connect to a patient in less than 60 seconds, which is called the instant consultation option. We further provided this app to consumers as well as corporate users because we wanted a B2B and a B2C channel for the app as well. And of course, the app operation really took up post-COVID because COVID gave us an opportunity to really penetrate the market. We started working with the government to provide healthcare services over app in the peak COVID time. And that really gave us a boost to up jump our operations and really grow in that time. And that has helped us. That momentum has helped us to date. And that's, I think what is different in Sehat Kahani as compared to other companies in Pakistan is we're a multi-population focused company. We work for the low income, from middle income, for the high income. We have a 24/7 patient feedback system and really focus on the doctors as well. So the doctors that are in the network are not just supply chain that we manage. We really build their capacity, make them learn new courses, have engagement events so that they feel like they're a part of the community. A lot of doctors lose their self-esteem, the female doctors that we have. So we really work hard to bring back their self-esteem, their self-confidence to start working again. So up till now, Sehat Kahani has created a network of 7,500 healthcare professionals, 81% Pakistanis and 19% non-resident Pakistanis who have a Pakistani license but live outside Pakistan. It gives them an opportunity to pay back to the country and also work for a lot of specialities which are not available in the country. So that's been really helpful. And in the last, I think, 5 years that Sehat Kahani has existed, today Sehat Kahani has the largest clinical network in Pakistan. We have 59 clinics across the country. We're present in all 4 provinces, as well as in the state of Azad Kashmir, which is a state within Pakistan. We've become the biggest corporate provider of healthcare in the country because when we started the app operations, we found more value in B2B, giving it coupled with insurance as compared to giving it to consumers. And we rapidly penetrated that market before competition. And now we are the trusted provider for 4 insurance companies in Pakistan. And through those, we cover 650 corporates. So our app is coupled with insurance and given to consumers. We've done almost 2 million consultations till date. We have 1.3 million downloads on the application. And overall, we've impacted 7.2 million beneficiaries. And this is just a snapshot of the corporate sector that uses Sehat Kahani app. So from financial sector to pharmaceuticals, to FMCGs, to insurance and telecom, we cover some of the biggest corporates in Pakistan. So for example, HBL, which is Habib Bank Limited in the country, has 16,000 employees. Mizan Bank has around 18,000. And we've really provided them app services to a good 90% of that workforce. And I think the biggest thing that I want to mention here is that when we talk about democratization of healthcare, I think how we've done that on the app is that, for example, in a bank, the CEO and the janitor is using the same app, has access to the same doctors and can connect to the same doctor at any time. So I think that we've done really well. I think one of the secret sauce has been the technology. We've always kept it very simple and easy to use. In 2 clicks, you connect to a doctor. We have a real-time dashboard that tells us where, how many, what consultations are happening. We have a 3-way chat window in our clinics, multiple payment options on the consumer app. You can now book your lab and order pharmacy through the app as well. But just try to keep it very simple in terms of a user interface so that people of all ages can use it. As we're growing now, Sehat Kahani has become, and I don't actually call myself a social entrepreneurial business. I call myself an impact business because we have an impact wing and a business wing, a very strong business wing as well. As I said, our B2B product has done really well in Pakistan. We are now moving into pharmacy solution for corporates and also claim management for OPD reimbursement through our doctors. So we're also diversifying how our doctors can help patients, not just through consultations, but through claim management and pharmacy. And we're also adding new growth drivers on our consumer app. One thing that we're ferociously working on is home healthcare. So sending an assistant or a nurse to patients home on daily basis and get them connected to online doctors for critical care patients, special patients, specially able patients, mental health patients who cannot go to hospitals and are stuck at home with their diseases. And we also have raised a lot of money. Alhamdulillah, for a Pakistani company. We were the first female-led company to raise a pre-Series A round in the country ever. Now we're raising a Series A round of $3 million, and not the best time to raise, but we're trying. So we're almost there. We've raised 2.2 million out of the 3 million. And I think what it will do in the next 18 months, it will help grow our growth drivers and make sure we are reaching out to 5 million users and doing 4 million consultations. And I think the next thing that I see for Sehat Kahani is not just staying limited to Pakistan, because I do feel that inequity in healthcare is such a global issue. And there's so many other geographies in the world where there's a doctor-patient mismatch, and what we created can be easily translated in those geographies. So after our Series A, we're planning our Series B and our regional expansion, which is to move out of Pakistan into the Middle East, Southeast Asian region, so that we can extend our impact into regions where there are other issues. And I think the vision, of course, in numbers is to reach, 12 million users and 23 million consultations. But I think more importantly, the vision that I carry is that, every disease, a lot of diseases can be stopped at a primary healthcare level. And the reason why that doesn't happen is because the patient doesn't get to know, they never reach out to a doctor. So our vision is to not just cure patients, but improve their quality of life and their life by coming in early as a telemedicine solution. So I'll stop here. I'm happy to answer any questions that are further there.
Thank you so much, Dr. Sara. This is like story of a glory. It's an extraordinary journey, extraordinary impact. And I should say that you are also changing the definition of Dr. Bride. I mean, next time parents will say, that's a Dr. Bride I want. So thank you so much. But I know that, this story, that the organization has not just commendable work, but a lot of commitment of good team that has built this venture. So I'm sure, it's not just about kind of a smooth journey. There has been a lot of hurdles and challenges that you had to maneuver your way out. Just to mention before we go forward, we have almost about 100 people watching us right now, and they're very, very inspired with your story. So, Dr. Sara, you spoke about this glorious story of kind of, how you arrived where you are, and kudos that, kind of you are growing despite all that is happening around the world. But what I want to ask you is that about the hurdles and challenges. When you got started, there were certainly some challenges that you had to deal with, apart from kind of finding the solution, how to address this big solution. So what were some of these challenges that you faced in setting up your venture, and how did you overcome that?
I think the very first challenge that I faced was transitioning from a doctor to an entrepreneur myself. Without any formal education. So I remember we launched our first clinic and it was a success. And I thought that great, I've cracked the code and now every clinic that I open would be a success. And I was 26 and I was very hyper at that time. We launched our second clinic and the clinic did not work even one day. In fact, I got a death threat after launching that. And I realized that in a very conservative Muslim community, the nurse that I kept in that clinic was Christian. And unfortunately, for the dynamic of that community, that did not work. People did not want a Christian nurse handling them and connecting them to a doctor. There was this is something that, when my clinic failed, I really sat down and I made myself understand that if I need to do this, I need to do this properly. And that's when I enrolled myself into a lot of entrepreneurial courses, accelerator programs, just to groom myself and understand what is the value of a business plan, a financial model, customer segmentation, needs assessment, surveys, researches, and I learned that step by step. So I think that was the first challenge to getting myself prepped as an entrepreneur. I think the second challenge was really acceptability, that this idea can work both from a patient's end as well as from a peer's end. So I think when we started the clinics, we didn't have any patients walking in. They were deserted for the longest period of time. And, because people didn't really trust the camera, WhatsApp was not very prominent in Pakistan. People were still scared that, someone will make a video and they will put it on the dark web or going to sell it somewhere, particularly in conservative communities. And I think we cracked the code when we started incentivizing the nurse. Because we realized that, the nurse is the main person sitting in the clinic. And if she can tell the patient that this is a doctor you can trust, people will believe her because she has been in that community for over good 10 years. She's already providing services. She's the main healthcare provider in the community. So selection of the right nurse became very important. And the nurse championing us became very important. And we saw that as we incentivized her, both financially as well as non-financially. So saying that, you are the person who will connect the doctor to the patient. You are very important. So giving her respect, making her a part of our network, and also financially incentivizing her. That is when we saw patients started coming in and it became a trickle-down effect. So it was only to get that first pull in, because when a patient came in and they saw a doctor on the screen and they started getting treated, then they went and they told their family and their family told someone else's family. And then, the rapport started building and the word of mouth spread. But that has been a very helpful learning for me. I think the third was really making sure that it works operationally. The revenue, the business model works because initially it was a very slippery slope of converting it into an NGO altogether because we charged 100 rupees per patient and we weren't saving much in gross margin. But fortunately for me, I'm not very good in asking for money. So I knew I could never fundraise for donations. I'm not a person who can go up and ask someone for money, that give me money for this charity. I can't do that. So I always knew that I had to add another vertical for it to make money through business. And that's where the app idea came in. And I think when we started making the app, everyone around me, including advisors, investors, my own family, because it's and I say this a lot of times, it's very easy to see a woman building a social enterprise. It's softer, it's nicer. But when that woman goes and jumps into a technology business, everyone is like, oh, whoa, how will she do it? And I'm not a techie. So, I was a non-tech co-founder and a doctor. That is even worse. So everyone told me not to do it. But I think me and my co-founder, and we did a lot of mistakes. The first app we made, we gave it to a group of freelancers to save money, and we got it in 6 months. And it was a Chinese ripoff. Like they had put layers after layers of ripoff and gave us a completely fake app. We lost our money, we lost our hope, and we were deserted with a useless app. But I think that understanding, going through that process and really understanding the value of good technology was a challenge that I'm glad that I took at that point, because that really helped me understand. So I literally then studied how apps are built, what goes in the back end, what goes in the front end, how is data stored. I really made myself go into that trouble. And I really learned how this works and how do you get the best people to make it. And then next time we made the app, it was much better. I think the fourth challenge was running the company on two verticals. Because when I went to grants and donors for the clinics, they said, why do you have the app? Why do you have this vertical making money? And when I went to investors, they're like, why do you have the clinics? You should just have the app. So convincing everyone around us that we're a hybrid impact business in which one vertical makes money and one vertical makes impact, and this works for us, even if it doesn't work for you, and raising money from investors and institutional funding at the same time, I think that was a huge challenge. And seeing that the business model works in which the clinics are making some money and the app is making more money, and how we're setting the pricing and how we're selling it to people was, I think, a big challenge. And it took us a lot of iterations in the business model to really come to a pricing that makes sense, and a lot of hours in crunching numbers in the financial model. So I think that is the challenge that we overcome. And I think one very, it might sound very cliche, but two women doctors and two women running a company of 300 people. It was very challenging internally, externally to prove your mettle, because you're extremely judged on being a leader, being a female leader still. And I remember I've walked into rooms and I've been told, who's running it? Who's the person behind it? And I say there's no one, and they don't believe me because they see that somewhere there's some guy who's handling it at the back end, and she's just a face that's there. I've been told in meetings that I need to bring someone senior next time I come to the meeting. That I'll take 70% of the company because and I'll invest in you because you have so much to do. You have to take care of your children and your parents and your spouse, and you won't have time. So there's a lot of external, internal challenge you have to face while you're leading. Sometimes you're the only woman in the room who is there, who has to make a point different than the others. But I think both me and my co-founder have worked extremely hard to reach to a point where I think when we enter a room, the gender becomes secondary. At least I feel this about myself, that when I enter into a room, I leave my gender outside, because when I enter, I know that I'm here because of the work that I do. So there have been many challenges. Fundraising as a female entrepreneur has been an extreme challenge. It's the playing field is not level in Pakistan. Women cannot hang out in dinners and coffees and and have that casual conversation. Investors as men have the opportunity to. So staying in that cultural limit, making sure that it takes double the effort, I think, as a woman to raise money in the country. Also, I think in Pakistan there's a myth that women cannot handle money, or it's a risk to invest in women as compared to men. So I think that has been something that we've fought over and over as we've raised different rounds of funding. So lots of challenges, but I think, we've found some very interesting solutions to the challenges as well.
Great. I'm glad that you mentioned the women who are like, being a woman or the gender thing, because I was thinking that probably is the first challenge. Why will people come to a set of like two women trying to find a solution to something as serious as like healthcare, and everything else follows. You are one of those optimists who find opportunity in every difficulty and challenge, it seems. But yeah, we've got a very interesting question coming from one of our live audience, Charlotte. And Charlotte is talking about, you just mentioned about the fear of people being on camera. So
Yeah.
Charlotte is saying that Charlotte also works in a digital healthcare in the field. And one of the biggest challenges that she has is patients' data security. How does it work for you? How do you make sure that the data is secured?
So I think in terms of people not appearing on video, absolutely, that is still there. But I think we've learned that on the application where people are literate and in charge of their own mobile phones, owning the technology that they're using, I think the opportunity to choose which medium of consultation they want should depend on the patient. So our consultation starts with a chat. There's an audio and video button in it. If the patient wants, they can open their video. If not, they can share pictures of the area that they want to discuss about. So it totally depends upon the patient. Our doctors are advised to make the patient switch to video, but they don't force it. They recommend it, but they don't force it. I think in terms of data security, we have extremely secure servers. We work with Microsoft Azure Cloud. I think one of the 3 companies in Pakistan who do quarterly data security audits with an SSL certification. There are only 2 companies in Pakistan do it. So we regularly check for any breach, any data insecurity that can happen. We try in different mediums, in different environments. And I think our security break right now is 0.001%. And we did that because a lot of breach happened in banks in Pakistan in May 2019, 2020, just before COVID. So we started taking care of this. We also have done a lot of certifications for quality control. Pakistan has some certifications that looks after quality control of operations. So we've gotten those certifications as well. And we have a whole tech data security team, as well as a QA team that monitors that all the data is secured, encrypted, mirrored, stored in different Jenkins servers, which are Microsoft servers, with mirroring, so that even if one goes down, there is mirroring available of that data at multiple places. So we've done, I think we've done well in maintaining data security. Until date, we haven't had any episodes of any data breach at any point.
So data audits are great tools to kind of ensure that.
Very, very, very great tools with the right people. And I'm sure a lot of other countries have many, many more data auditing teams. Pakistan, unfortunately, has only a couple, but if you have access to it, then definitely quarterly data audits are extremely important.
Great. So thank you so much about talking so much about the challenges and so much about kind of what went behind establishing the organization. I like to change gears a little bit and then kind of move to the competitive landscape. So the pandemic happened and it boosted medicine market, and Sehat Kahani was already doing it. It had the technology, it had the expertise. So tell us a little bit more about it. And I'm going to while you talk about the Sehat Kahani story of telemedicine and being ahead of the game, there is also a question that's come from two participants who are watching us from India, Chandramouli and Anju. And they are saying, based on your experience, what are challenges of implementing telemedicine in rural regions? So they are also working in rural regions. So they would like to learn about what are the challenges of implementing in rural regions.
So I think when COVID came in the country, this is March 2020 when we got our first case. And on 20th March, so 3rd March, the first came, and 3rd March, the first case came. And 20th March, the country was put in a lockdown. And on 17th March, 3 days before the lockdown, I got a call from the federal government in Islamabad that they wanted to give our solution to everyone in the country as the country goes into lockdown, because we were at that time the most easy solution to use for consultations. A lot of other companies had telemedicine, but they were more doing automated appointment booking. So their system wasn't as strong. And I was a good salesperson, so I sold them that my solution is much better than any other else. So they just took up the solution and started marketing it left, right, and center. And before that, the app had already only been out for like 3 months. We launched it in December 2019. And by that time, there was not a lot of usage on the app because Pakistan was still in this mode where digital technology was not trusted, e-commerce was not happening. People still believe that, if you touch the pulse of the patient, that is when actual medical help can happen. So we're fighting a lot of stigma from the patients and a lot of resistance for them to coming on the application and showing to a doctor. But as we gave our app throughout Pakistan to a mass market, I think there was massive learning in those 6 months. I joke about this because when my husband was gardening and making burgers and trying cooking, I was working 16 hours a day with my team to make sure that the app is up and running. So one thing that we did was, we amplified the app operations. We, from 60 doctors, we went to 1,000 doctors. From 60, 70 consultations a day, we went to 1,000 consultations a day. It was just crazy all the time because everyone needed a consultation. And we really channelized the team at that time to manage operations. So everyone was a part of the app team then. And we set up a 24/7 call center. So we started that call center on 19th March, and it hasn't been down since one day till date. It has been continuously 24/7 on. And I think the secret sauce that I implemented was every patient who did a consultation on the app got a feedback call. So in case their call was missed or was canceled, or if the tech didn't work, someone called them in the 15 minutes and said, we know that your call did not happen. We will give you access to another doctor. And I think that when we ask for feedback from patients, I think this is the single most thing that they like, that someone called me and took care of me and just made me feel really, really important, which is a human psychology, right? So I think that worked. And then, but the app was free. So the consumer app, although the government was using it, they were using it for free. So we weren't making any money and we were short on cash at that time. So me and my co-founder thought, what can we do to make more money? And we need money to survive. We can't just go down in COVID. And that's when we realized that, the easiest way to make money is go into the B2B market and give it to corporates who at that time had no solution for their employees sitting at home. And they were looking for solutions to give this instant consultation option to employees, and they were willing to pay for it. And we just banked on that opportunity. So my work was, I used to just call everyone that I knew in my circle. And I used to say, I have a proposal, just send it to any corporate that you know. And I think we approached to almost every corporate in Pakistan at that time, and 2030 took it, and they used it and they paid for it. And they started talking about it in their corporate circles. and slowly and gradually the word of mouth spread that there's a solution that can really work for corporate sectors. And I think that helped us grow into the corporate sector. In terms of the question that was asked by the two gentlemen, I think because we started a rural market earlier than the urban market, we had more time to learn. But there are a couple of things that needs to be done. So in the rural market, we don't give out our application. We don't ask the patient to download the app and use it because we know that they won't have a smartphone, or they might not be literate to use it, or they might not have the data. So in order to prevent of that, we make a physical structure in which we put electricity, we put internet, we put the laptop. We make a very secure, guarded environment in where a patient can walk in and they just need to sit in front of the laptop and connect to a doctor. And for that, we have to maintain everything. So electricity should be there. So we use solar panels because there is limited electricity in rural areas in Pakistan. We put internet gadgets. We work with Pakistan Telecom Authority to grant us access to internet in special areas. And over time, we've built those collaborations. We've built partnership with telcos to give us internet. We've built partnership with solar companies to give us cheap solar. We've built partnership with community midwife organizations to find out these community midwives that can help us. And once the consultation starts to happen, I think from there on it becomes easier. But we have made a whole business model in the clinic that how much monthly expenditure we need to do, how much money we need to make per clinic, how will it make a business sense to keep that clinic running, and Now we have 69 clinics today, but we've closed almost 8 clinics because it just didn't work. Even after everything that we it did not happen for XYZ reason. But one thing that we do is we're very strict with ourselves. We give a clinic 6 months. If the clinic is not working in 6 months and not reaching numbers, we close it down. Because we know we can better use our resources in another community that is waiting for us. And over time, I think our model became much more easy for the government to use. So now we don't open clinics individually. We actually take government setups and convert them into telemedicine centers. And instead of the patient paying us, then the government pays us. So we've changed our buyer from B2C to B2G, which has really helped in maintaining our operations well as well. And that's the future I see for the clinical network, is that the government contracting it out to private providers like Sehat Kahani.
Nice. You actually also answered one of the questions I had about collaborations and giving some examples. So you already spoke about government. You already spoke about working with some public limited companies. So thank you for that. We've spoken about challenges, but I think another important area for entrepreneurs is to look at opportunities and look at opportunities wisely, because opportunities could be short term, opportunities could be long term, and based on that, they can also yield you results. So what are your golden rules of identifying and pursuing new opportunities?
So I'm a person who gets bored very quickly. So I can't do one work all the time. So my specialty in my company is, and that should be my specialty in my company, is I create a product, I design it, and then I take it up initially and I'm very excited about it. And then I give it to a team and I move to the next baby who's coming in. But I think constantly keeping yourself, good opportunities is important to keep yourself motivated, because no matter how much you love a solution, it does become repetitive and redundant. So for example, now, as I said in my presentation, the clinic was one opportunity, but then we saw another opportunity in the app. And I told you that everyone told us not to do it. But me and my co-founder, we looked at each other and we said that, what is going to happen if the app doesn't work? It's going to fail, right? That's the worst thing that can happen on planet. But at least let's try. 20 years later, we don't want to think that, okay, maybe if we had made the app, maybe we would have been successful. So we did it. And, I think I have a huge belief in, of course, spirituality and faith. And I think we got the opportunity to expand the app operations after COVID. But I think then we got that brink of an opportunity in COVID. We also utilized it extremely well. I met someone last year and he said that, when you were giving your corporate application at a very subsidized rate, there was a competitive company who was charging 3 times in you. So they did not see a long-term opportunity. I saw a long-term opportunity that even if they're using it for peanuts, those peanuts are going to convert someday to bigger peanuts and then to gold coins. But right now we need to make them use the solution. They need to trust it.
Yeah.
I think for the answer, last answer, I forgot to mention this, but in rural communities, I think people don't believe in gadgets and technology. They believe on trust. So if you can earn the trust of the patient, particularly of low-income areas, they will keep coming back to you. And that's what the doctor-patient relationship is. 70% of the time, it's just trust, because you believe what the doctor is saying. So as we started, building our corporate app, and then we had our clinic, we had a corporate app, we have a retail app. Then we also launched a helpline because we had a call center sitting for customer service. I was like, why not use this opportunity if a patient can't come to a clinic and they can't use our app? Just connect them to a doctor on call. And again, someone might say that, why? You already have the clinics, you already have the app. Why do you need to have a helpline as well? But we made the helpline and it got picked up by Lifeboy, and now it's being celebrated. It's propagated everywhere in Pakistan through Lifeboy. It's called Lifeboy Laya Free Doctor, which means that Lifeboy is giving free doctor. It's on every pack of Lifeboy. Our logo is there with a helpline number. And it's packed, it's for 3 years and everyone can access the helpline. And it's a remarkable service that goes on 24/7. So, once you take up an opportunity, I think the universe kind of helps you succeed. And now, as we've done consultations to the T, I think now I see an opportunity that, if a patient is coming to us for consultation, why not give him medicine? Why not give him diagnostics? Why not give him home health care? Why not really help their whole journey? And as you start creating a network of collaborations, of partners, you then see that the process of doing that becomes easier and easier. So as we launched our pharmacy, I think we had a huge benefit as compared to competition in Pakistan, because everyone was doing consumer pharmacy. Sehat Kahani started doing corporate pharmacy, which is much more, which is much less cash intensive as compared to a consumer pharmacy model. So I think you really need to, I think we fear change because get very comfortable. And when you build something and it's doing well, you don't want to touch it and kind of destroy what you've built. But I think if you stop doing that, then the innovation closes, and somewhere someone is going to think that I can do it better, and they're going to come and take over. So if you want to be, you need to keep evolving and innovating to have that X factor. Otherwise, there's going to be someone who's going to take the lead on it.
So I think what you said is opportunities that can help you build trust and credibility, and also ability to take calculated risk should be pursued for long-term benefits.
For every opportunity, you need to really not just think it, but do it, put your heart and soul in everything around it. I think that's what I think a lot of people miss out on. That it is not the idea. It is only the execution that matters.
And there is a great quote that says, like, God helps those who help themselves. So we should be practicing that. Great, Dr. Sara. There are so many questions that is just coming. But in paucity of time, I'm going to move to some of the finale question, which is very important. What are some of the greatest lessons that has come your way as a social entrepreneur that can be adapted by social entrepreneurs? And also Sana Qureshi is asking, what is your advice to all the learners in leading their entrepreneurial journeys?
So I think the lesson learned for me is, I believe that every problem is a social problem, particularly in countries like Pakistan, where there are so many economical, political, social, natural challenges. So if you think that you really feel about a problem and you have a solution, and if there's no one else doing it, and so ask yourself these questions. Am I the right person to do this? Is it the right time for me to do this? Am I mentally, physically, emotionally ready to take up this challenge at this moment? Because sometimes you must be all motivated, but you have family, you have sick parents, and you need it somewhere else more than that problem. So always choose that. And third is that problem is not your life. It's a part of your life. It's a very important part of your life, but it is not you. A lot of particularly social entrepreneurs, because they're solving such a huge challenge, they kind of associate their whole personality with that problem. And even if it's not working out on ground or financially, they're afraid to close it down because they feel that they're going to lose their identity. But that's not true. There are enough challenges to be solved in the world. And if one fails or if one doesn't happen, you can always go up and take up another challenge. But you need to ask that question to yourself, very importantly. So I think that was lesson one for me, to understand what works and what doesn't work, and how do I need to find the right solution for it. I think the second thing that I learned is, can you just give me 1 second? One second.
Sure.
Sorry. So I think the first lesson learned for me was, to ask myself these 3 questions again and again to see if I'm ready to still take on. I think the second learning for me was that nothing is permanent. So pivoting is very important. We pivoted from the clinics, also adding the app, then also adding the corporate app, pharmacy, and the diagnostics. So constantly iterating and reiterating your business and financial model, finding better solutions for yourself and breaking that initial barrier that, I've made the best solution and there's no questioning it. The third lesson for me is you can't do it alone. You need to have that. You need to have those people backing you. You need to have a very solid team of leaders that you build. So if anyone thinks that they can do it alone, it's absolutely not possible. And you need collaborations. You cannot create everything on your own. You need to build a network of collaborators, of clients, of consumers that will trust you, that will help you, that you will help. So I think that's something very important. And partnership building for an entrepreneur is extremely important. So that was my lesson 3. And my lesson 4 was, in terms of fundraising, that not every investor is your investor. So you need to really find people who will believe in your vision as a social entrepreneur, because social entrepreneurial funding is extremely limited. For women, it becomes, you slash it more. For women of color, you slash it more. So it just keeps going down. The pie keeps getting thinner and thinner. So you need to find in investors and so that also become your champions. I think that we've raised less investment than many of our many other companies in the world. But I think whatever money we've gotten very good people behind that money who really help us in our troubles, in our low times, give us solutions to improve. So you really need to find that team of investors that will help you grow. And I think the last and final thing is that you really need to be in it for the long run, particularly for social entrepreneurs. For commercial entrepreneurs, you create a business, you sell it, you move to another, that's okay. But when you're solving a social problem, it's slow, it's painful. There are much more failures than wins. So yesterday, I had an investor who said, I'm lowering my investment. Then I had a team member coming in and saying, I'm quitting, I'm going to Dubai. And on top of that, our credit card got blocked and we couldn't pay. And we had a penalty of $2,000. So there's so many challenges that come on your day. That then there's so many failures that you face that really bums you out and says, why am I doing this? But what wakes me up in the morning is, in the night, I got a call from one of my friends and he said, I use Sehat Kahani for my mother and it was such a great service and thank you for building this. So I think those are the wins you need to reach out for, but they will come lesser than the failures. So you really need to be committed for the long run. I need to solve this problem patiently and with consistency, the perseverance, rather than taking the short leaps of success. So I think those are my lessons learned, if I can put it.
And thank you for being so candid about failures and being so realistic about it. So thank you so much for sharing so many tips and ideas about your business acumen and intel. And I'm sure everybody has taken a huge intake of wisdom from you. But I want to ask you one last question, and that to you as an individual. You're a high-performing founder. You are a social entrepreneur. You're a doctor. How do you take care of yourself? How do you remain healthy, motivated, and forward-looking?
I've not I don't manage it very successfully, to be very honest. I was a workaholic for the first 4 years that I was building the business. Everything was about the company. Everything was about, launching a new clinic or giving an app to a corporate. I had a huge burnout post-COVID in 2021 because, it took a toll on me to work so much. And I later on realized that, work-life balance is extremely important. I also have 2 tiny individuals who need me. So I've started working less and I've started delegating more. So I think number one thing that I did for myself is I started acting like a CEO and not as a COO. So not micromanaging people, but finding leadership that can lead teams rather than me. The second thing that I do is I do work out. I build my physical energy, and I fell very sick also in those years. So I build a lot of physical energy. And third thing is, I've kind of realized that it's extremely important to me. And, this is something that I want to do for the long run. But in order to do it for the long run, I need to be physically, mentally, emotionally capable enough to be doing it. And the final thing that I've taught myself is failure is okay. A lot of things will not happen to you, but then one thing is going to happen is going to make up for those 4 things not happening, and they will happen if you keep on at it. So I know I'm in it for a long haul, and so I was very emotionally attached to the company. I've detached myself a little bit to give myself that room to grow as a person as well, and I've also kind of evolved myself. Just not as CEO of Sehat Kahani, but also someone who's really passionate about public health. So I've given myself the opportunity to also find things that I'm passionate about outside the company, to talk about public healthcare policy, to work with the government, to create a policy, to also use my expertise more generalistically. so that, not everything in my life is just about the company, but also fulfills me as a person outside the company. So I think the biggest thing is then, when you see the app working, when you see patients getting treated, when you see new clinics being opened, it always gives you a high, and that's what keeps me going. The final thing is I have two daughters, and having two daughters in Pakistan is not a normalcy for a lot of women. We have a lot of male child complex in the country. But when I see this, I think that's extremely important for them to see a working mother. And they need to see that there's a father who supports that mother. There's a grandmother who will take care of them while the mother is working. Because when they grow up, they need to grow up with the notion that it is okay for a woman to work and a woman to have her own company. It is normalized, because it wasn't normalized for me. I used a huge social stigma in creating my own work and running it for so long. But for them, they should feel it's completely normalized. And I think women in my generation need to really make it a point to teach our daughters and our son that, this is okay to happen in a culturally conservative country. And that also gives me a lot of strength to keep on going.
This was a great conversation, Dr. Sara. I mean, you told us so many things, including the stereotypes in the global South, which I could echo. And I'm sure a lot of us from the global South are echoing this about the patriarchy, about the ways women entrepreneurs struggle and everything. So thank you so much. It was absolutely a delight to host you. Thank you so much for your generous time with us, and congratulations for continuing a remarkable change-making journey, and all the best to you.
Thank you so much for having me, and looking forward to be here again next year. Thank you.
And I shall continue to follow your work through social media and LinkedIn. And you're such an inspiration. And thank you, everyone, for joining us, and hope the module 2 is helping you to focus on identifying the social problems that you will like to pursue and the ways you can explore your opportunities in your context. So feel free to connect with your peers in the discussion forum and engage in conversations, both to learn from each other and also collaborate. And remember, next week, we will be opening module 3 that is going to talk about strategies of advancing social innovation in your institutions. So hold the date 4th of May to be with us for the 3rd webinar of the season, where you will meet Tony Joy along with my colleague, Natalie Zuniga. Thank you, everyone, for joining us, and see you soon.
Thank you, everyone.